Hi, dear friends. Let's discuss today a very important topic of the day. Today, I am going to discuss Corona COVID-19. What is COVID-19? A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. COVID-19 is a disease caused by SARS-CoV-2 that can trigger a respiratory infection. Everybody in the world knows when it started. COVID started in December 2019 in Wuhan, China. Later on in January, it was declared as a pandemic. It spreads from person to person and infectivity range from mild to deadly. Let's discuss the symptoms of COVID-19. The main symptoms include fever, cough, shortness of breath, trouble breathing, fatigue, chills, sometimes with shaking, generalized body aches, headache, sore throat, loss of smell and taste, nausea, and diarrhea. But nowadays, most of the patients are COVID positive and they don't have any symptoms. So they are called asymptomatic COVID positive patients. The earliest complications which were known from the COVID was pneumonia, respiratory failure, septic shock, and death. But nowadays, we are finding thromboembolic association with COVID-19 as well. Very important question. How do we know that we have COVID-19 or cold or flu? It's generally known that COVID-19 has the same symptoms similar to bad flu or cold, but once you go to the doctor, how there are two common symptoms of COVID-19, that's a fever and cough. But and he asked you about traveling to a country where COVID is common, or if you have any contact with a COVID positive patient directly. This is a table that shows this how can we differentiate between cold, flu, allergy, and COVID-19. Here we can see the most two common feature of fever, this is common in COVID-19, cough, this is common in COVID-19. However, other symptoms, headache, generalized body aches, fatigue, extreme exhaustion, runny nose, sneezing, sore throat, shortness of breath, loss of taste and smell, and diarrhea. They can be found in other diseases as well, but most common two symptoms, that is fever and cough and COVID-19. What are the risk factors in COVID-19 patients? Well, anybody can get COVID-19. I can get, it can be a COVID-19 positive. There's no age limit. It can also affect children as well. And as we earlier discussed, it can be mild to severe. The well-known high-risk patients, which are mostly seen internationally affected by COVID-19, their old age, mostly over 65 years of old, with comorbidities like high blood pressure, heart disease, lung disease, asthma, kidney disease, obesity, diabetes, immunocompromised, cancer patients with chemotherapy, liver disease, cigarette smoking, and alcohol intake as well. It's not hidden now how the coronavirus is transmission is going on. It's well known, it spreads from person to person. It spreads when a sick person cough or sneeze. They produce droplets, and if other person they inhale these droplets, they are directly affected by coronavirus. And another way we know this touching the surface which has droplets of COVID particles. Once you touch a surface with COVID and you touch your hand to the mouth, nose, or your eyes, you are going to be affected as well. Well, the contagiosity of the coronavirus is highly contagious. It can transmit from one person to 2 or 2.5 or more. The further studies are going on its contagiosity. Well, it's very important question. Can coronavirus be transmitted through groceries, packages, or food? We are much more likely to get COVID-19 from another person than from packages, groceries, or food. But it's better if you're a high risk patient, you should avoid to go to the groceries. Better to have online grocery shopping. So you will not be exposed to many surfaces and many people. And you can bring your grocery at home, keep in a one place, wash it, and then keep it in your refrigerator. And the area where you place this should be disinfected. Wash your hand frequently, at least for 20 seconds before and after bringing things into your home. The coronavirus can linger on hard surfaces, so clean and disinfect countertops and anything else have, your bags have touched. You can wipe down plastic, metal, or glass packaging with soap and water if you want. Diagnosis of coronavirus. Most of the patients they are diagnosed with fever at 100 Fahrenheit or higher, cough or without cough, trouble breathing with or without trouble breathing. We are going how we are doing this the swab test. We are going to do the swab test to diagnose coronavirus. The most common test is used now is nasopharyngeal swab. This could be a rapid or normal, and if it is positive, we label a patient as COVID positive, and we isolate and start treating the patient according to the symptoms. Well, it's well known prevention is better than cure. So how can we prevent from coronavirus? We can wash our hands with soap and water or clean with an alcohol-based sanitizer. Practice social distancing. Stay at least 6 feet away from others. Cover your nose and mouth in public. Don't touch your face. Clean and disinfect. You can clean first with soap and water, but disinfect surfaces you touch often, like tables, doorknobs, light switches, toilets, and sinks. Nowadays, everybody is a layman is asking, is there any benefit of face mask to protect you from infection? Yes, it's highly recommended to wear a face mask. if you go out in public. This is an added layer of protection for everyone on top of social distancing efforts. You can spread the virus when you talk or cough, even if you don't know that you have it or if you aren't showing signs of infection. Well, the question of the day, is there any vaccine for the coronavirus? Till now, there's no vaccine for the coronavirus. There are multiple companies internationally. They are in effort. They are trying to make a vaccine, but till now, there's no vaccine in the world. Well, the treatment, if the patient gets corona positive, depends upon the symptom, and asymptomatic patients, they are only isolated at home or in other areas where they don't have the contact with other person. But symptomatic patients, they are admitted in the hospital and they're treated according to their symptoms. And the other question this keeps in mind everybody asking it, if we get coronavirus, is it possible that we will get it twice or no? Still, it's not clear and nobody's sure. The person who gets corona positive and he gets recovered, will he get another time or no? Still, there are no studies. So the best option to get away from the corona, COVID-19, stay home, stay safe. Thank you very much. Hope this will help, tutorial will be helpful for all of you to save you and your families. Please subscribe my channel and learn.